Treating diabetes using a keto diet program. Sometimes diabetes is misunderstood. One common misconception about diabetes is that people with type 2 or diabetes have consumed large amounts of sugar before they developed it. This is false. Although sugary donuts and soda can lead to diabetes, many people have blood sugar levels that are not related to soda. Many people with diabetes have never had soda, and they eat a lot of fruit, not junk food. People with diabetes, such as type 1, have seen their blood sugar levels drop by following the keto diet. Some patients are able to have their medicine reduced or eliminated by their doctors. Type 2 diabetics are usually given oral medication, while regular diabetes sufferers require insulin injections. Carbs are known to raise blood sugar levels the most. The keto diet reduces carbohydrate intake and increases fat to provide the energy required. Running is encouraged for diabetes sufferers. It's a vigorous exercise that promotes sweating and burns fuel. A fat-based diet that contains ketones provides fuel for diabetes sufferers. They usually have better blood sugar levels than those who eat high amounts of protein or carbs. Have you used the keto diet to treat any illnesses you have had? Comment down below. Like, subscribe today for future updates.